I'm not here as a celebrity. I'm not here as a politician. I'm here as a mother. A mother who cares deeply about the world my children and all of our children live in. A world where we have the freedom to control our bodies.
Texas, what is happening across this state and our country is a healthcare crisis. And Donald Trump is the architect of it. He brags about overturning Roe v. Wade. In his own words, quote, "I did it and I'm proud to have done it."
Vice President Kamala Harris and superstar Beyoncé speaking about reproductive care in America during a rally in Houston on Friday night. Joining us now, we have reproductive rights activist Kate Cox. Also with us, CEO of the media outlet The Meteor, Cindy Levy, and the co-founder and CEO of All In Together, Lauren Leader. She is also an activist on women's rights and has been fighting hard. Kate, I'd like to talk to you. We're bringing in a lot of stories and a lot of women who have suffered reproductive emergencies because of Trump's overturning of Roe. I'd love it if you could, I'm sorry to ask for this, but at this time we can't mince words. If you could tell the story of what happened with you, and also there's an update that is somewhat hopeful.
Yes. First of all, thank you so much for having me this morning to share my story. I've personally seen the devastation by these extreme abortion bans in Texas. I'm a mother of two. Being a mother is the greatest joy of my life. My husband and I were thrilled to find out last year when we were pregnant with a third, but we received the most devastating news that our baby would never survive and that staying pregnant posed risk to my own health and to a chance for a future pregnancy. So we sued the state of Texas to clarify that we qualified under one of the rare exception bans, and I was denied that most basic right. So I had to hug my children goodbye and leave my home where my doctors are and flee the state for medical care. In the end, I did receive the care that I needed and had to flee my state to do it. But because I got that care, I'm pregnant today. So we're
but you had to leave the state in order not to be sterilized. Yes. I want to make this clear. Because of Trump overturning Roe, in order to not be sterilized and get the health care that you needed desperately, you had to leave the state. And you are pregnant today because you made that trip, because you were able to make that trip.
Yes, I had to flee my state to get the care I need. And, you know, I can't put into words how devastating it is to have to flee your home in the middle of a healthcare crisis. I developed an infection while I was traveling. My husband had to navigate finding antibiotics in a state we don't know, find pharmacies. I mean, it was heartbreaking to have to endure.
So there are a lot of stories right now that we are bringing in and trying to show them in any way we can. The Know Your Value Instagram has a just unbelievably gut-wrenching story from a husband's perspective. We're going to have more. Cindy Levy, The Meteor, just released a new article about a woman from Alabama named Tamara Costa who needed life-saving abortion health care desperately and had to flee the state to get it due to Alabama's strict abortion ban. The article features a video interview with Tamara and her husband Caleb, who already have a young child. They described this devastating news they received from their doctor 10 weeks into the pregnancy. Listen to this one.
The first thing he said, he sat down, he was like, I wish I had good news for you, but I don't. He said that baby didn't have a skull. Baby's heart's not in his chest. He went down and was like, I can't even see the lower extremities. He said that baby would not survive outside of the womb. And he said I could get sick, so he said, you know, termination was the only recommendation he was giving. She said, well, being from Alabama, I don't have a lot of resources for you here, but let me go see what I can find. And then she left and came back with a sticky note that said Planned Parenthood, Chicago, and had their number. We were terrified. We're miles and miles away from home. Mm-hmm. We have no family, it's just me and my husband. And we don't even, we didn't even know what was going on.
It hurts that I lost our child, but I really don't know what I would do without my wife.
I live in a state where, like, I couldn't get that help. It's like, baby wasn't gonna make it. So at that point, by not helping me, it was, well, baby's not gonna make it and neither are you.
You can find more of that story on The Meteor, which is pulling together these stories as well. Thank you so much, Cindy, for that. And Lauren, this is Trump's America. This is the reality versus the picture he's painting on stage in his closing arguments in these final days of the election. These women are suffering, and some of them are dying.
Yeah, he's going to be our protector while women are dying.
I'm a protector of women.
I mean, it's completely like another version of reality. But Cindy, I wanted to ask you, because the whole mission of The Meteor is storytelling around women's lives, and it does feel like these kinds of stories. There was also a very powerful Harris ad last week. Unforgettable Harris ad last week of another woman who went through a life-threatening surgery, and they walk you through the whole thing. What are you seeing as the impact of these gut-wrenching stories on the political environment? Because they're so personal, but clearly in some ways really breaking through.
I think they're incredibly important because they make clear that fundamentally these should not be political issues, right? I mean, Tamara says in our story, this isn't a Democrat or Republican thing. This was about human rights. This was about my health. And, she's a woman who grew up in Alabama, loves her state, and her state, she was diagnosed, by the way, with a partial molar pregnancy, which can not only cause multiple organ failure, it can also lead to cancer. This is something that needs to be terminated immediately. And because Alabama not only has an abortion ban, but also has an attorney general who has threatened to prosecute anybody who gives information about how to obtain an abortion, she was literally handed, you heard her say, a sticky note and told to travel 580 miles away to Illinois. And I think when you hear that, you understand that, this is basic health care. This is about saving people's lives. This should not be political. And I think that's one reason it cuts through.
Well, and for poor women who can't afford that, I mean, this is what my mother always said about Roe, is that the poor women suffer the most, because if you don't have the resources to fly to Chicago or travel, I mean, it's just unbelievable.
Yeah, and presumably that doctor, Cindy, actually, by even handing the sticky note, could have been liable. And Alabama's not the only state. There were, 14 states with total abortion bans, and I think every woman that was listening to Michelle Obama, and hopefully every dad was listening to Michelle Obama as well, is now asking the question, what would happen next? And how strong are the guarantees that this would not go further?
Well, I think it's very clear that, many of these politicians and lawmakers would like it to go further. I mean, in Alabama, the same state, is where we saw IVF become temporarily halted in the state after the Alabama Supreme Court had said that unborn children were, quote unquote, babies. They were children and they had legal rights as such. And so I think, there is a real ripple effect. And also, one of the things that was really important that I think Michelle Obama said the other night is that the ripple effect on other forms of women's health care is real, because doctors are not going to be able to go practice medicine and not want to go practice medicine.
Healthcare deserts.
In these states that, there's such a chill on even speaking, an actual true diagnosis to one of your patients.
So well said. This is exactly, and you're really crystallizing the message Michelle Obama was trying to make to men and women, including men who love them, because it's not just women who are pregnant and in a certain age category making a certain decision. It's not a decision when you're dying or your baby is definitely going to die, and if you don't get the life-saving health care for yourself, you will be sterilized or die. But these treatments, abortion health care, are used to treat women with cancer, women of any age who have medical conditions. And I would just say, just wait, Trump Republicans, until this happens to a woman in your life, until this happens to your daughter. And Kate, if you could speak to young women and men about the importance of stepping up and voting in this election. I feel like saying, as an older woman to the younger generation, we can't do this for you. We can overperform as parents and we can overfunction for you in many different ways, but we can't do this for you. What's your message to young people in this election?
There's so much at stake this election. We have to cast our ballot like our lives depend on it, because for me and for so many others, they do.
Reproductive rights activist Kate Cox, thank you so much for sharing your story again. CEO of The Meteor, Cindy Levy, we're going to be hearing more from you this week. Thank you for sharing the great work that you have done, pulling together these stories. And